Good evening, everyone. Good evening. How is everyone on this beautiful Monday evening? Hello, come on in. Hello, hello. Welcome, 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 everyone. Thank you for tuning in. I'm going to give some people a few minutes to join. Hello, hello, Aunt Sarah. How are you? Good, great evening. Yes, come on in the Just Gina's room. As always, I have a great show lined up for tonight. And I'm going to give just really maybe a couple of minutes to get have everyone come on in because I do want to try to cover as much as possible. Good evening, Missionary Morgan. How are you? It's been rough, Auntie. Today has been a doozy, a little of a doozy, but to God be the glory. Um, you know, we just keep moving and we just keep going. Come on in, everyone. Come on in. Click, tag, and share. Invite some people in. Tell them that the Just Gina's room is open. Health and wellness show. Hello, Dr. D. Good evening to you. We see each other again. I'm going to give some people some time to come on because once I get going, I do have a lot to cover that I want to try to get through. And I want to give myself a good 30 minutes here to cover this information that I was able to gather and put together to present to you tonight. For those that are tuning in and may catch the replay, welcome to Just Gina Skincare, Health and Wellness Tips and Talk Show. I am your host, Ron Gina. I am the owner and founder of Just Gina Skincare, LLC, and I am also a nurse, a certified wellness coach. And I like to provide factual information and awareness pertaining to health conditions and wellness to people in the community and people that may be viewing tonight on social media. So thank you for tuning in. I do want to take a minute and I want to put my disclaimer up because I do believe in as a nurse we have to cover ourselves. So I just like to be careful and make people aware. And my disclaimer here just states that informs the viewers that the views and thoughts are and opinions are expressed by solely by the author, which is myself or the host. And I always say this on every show. Every show, I strongly advise that if you do find something or hear something on my show that you would like to implement, I ask that you please seek advice from your medical doctor or your therapist. I always say do not abruptly start or stop any type of medication or treatment regimens without consulting with your medical advisor. And also, if you do have certain medications that you're taking, do not stop them and make sure it's safe to add any natural alternatives to what you're doing. So that is something that I express highly to anyone that's viewing and may find something that they would like to try in the future or after viewing one of my segments. Okay. All right here. And tonight here, let's get my banners up here. I've been using my daughter's computer, and I tell you, let's Is this the one here? All right, here. So tonight's topic here, and we're on this is season 2, episode 9. And for the month of March, I tried to cover for the remainder of this month here. I tried to cover some of the topics in awareness, recognize awareness for the month of March. And one of them was kidney awareness. So I do want to go over that, just talk a little bit about that. I want to talk about wellness, exercise, nutrition, mental, and just provide some information to the community that might be helpful or useful, or some things you might not have been aware of. So again, thanks to everyone that's tuning in, and we're going to dive right in here. And we do know that the kidney is a very important organ of the body. And basically the kidney here, good evening. My mother-in-law is tuning in. Good evening. We know that the kidney pretty much serves as a filter for the body here. And what it does is it filters for the body a waste and toxic substance, returning vitamin, amino acids, glucose, hormones, and other vital substances into the bloodstream. The kidneys receive a high blood flow, and this is filtered by very specialized blood vessels. I do want to make people aware that when you're viewing my show here, I like to take information and I like to take research studies. I like to take and talk about statistics. I like to present sound information where studies have been done, or, basically evidence of disease process. I haven't personally had an experience with kidney disease. I have in the past, from being a diabetic, had issues with risk of kidney damage, but from protein spilling into, but I thank God I don't have that issue anymore. So I'm going to go over some things that I found that was pretty interesting. And one thing, I love teachable moments. I always say that you can never learn enough. And even as I'm doing these shows, I am still learning a lot, because I have to be up on my game with staying aware of this type of stuff, even for the type of work I do, for the type of patients that I may come across in the field that I work in as a nurse, even for staying up on certain procedures and things for doing authorization. So I want to talk about the causes of kidney disease here. And one of the main causes that they have, or one of the most known causes that they have up here, is diabetes and hypertension. Now, it is other causes of kidney disease, which is genetic disorder. And that is one of the things that they have listed as polycystic kidney disease, PKD. An infection is another cause. A drug that may be known to be toxic to the kidneys. Another disease here, lupus, can be a cause of kidney disease. And then we have heavy metal poisoning, such as lead poisoning. We have rare genetic conditions, such as Apert syndrome. We have renal artery stenosis. So these are some of the other causes of kidney disease. But one of the ones that stuck out the most is diabetes and hypertension. One of the things that I did put together in my notes here is saying 10% of the population worldwide, 10% here, is affected by chronic kidney disease, with over 2 million people worldwide receiving treatment with dialysis or a kidney transplant. So World Kidney Day is actually on March the 11th. And also, that's why they want you to try to boost the awareness during this month. And also acknowledge the 850 million people living with kidney disease worldwide. So as eight studies show that is 850 million people living with kidney disease worldwide. So I want to go over some of the things, some of the things that kidneys do, healthy things kidneys do. It regulates body fluid levels, filters waste and toxins from the blood, release a hormone that regulates blood pressure. That's some of the healthy things that kidney does. Activates vitamin D to maintain healthy bones. And these are some of the healthy functions of kidneys. Also, it released the hormone that directs directs production of red blood cells. Keeps blood minerals in balance, and that's your sodium, your phosphorus, and your potassium. 8 problems that kidney disease can cause here. And the 8 problems, we have heart disease listed, we have heart attack, we have high blood pressure, we have weak bones, nerve damage, kidney failure, which is known as end-stage kidney disease, or ESD, or ESRD. I'm sorry, y'all. Anemia or low red blood cell count. So the 5 main risk factors: diabetes, high blood pressure, heart disease, family history of kidney failure, diabetes or high blood pressure, and then obesity. So here we have the additional risk factors, which is age 60 or older, low birth weight, prolonged use of NSAIDs, which is examples are painkillers such as ibuprofen or naproxen, lupus or other autoimmune disorders, chronic urinary tract infections, and kidney stones. So here I'm going to talk a little bit about nutrition here. And I like to talk about nutrition. And I'm also going to cover some of the supplements that you should avoid if you have kidney disease. And I'm talking about the herbal supplements. I have a pretty good list here. Some that is really not talked about or mentioned, but because I do function in the wellness side, and I did studies and took classes on that, some of these natural herbal supplements, I just went a little bit deeper into gathering what would be a disservice to someone to take if they had any type of kidney disease, or they would be at risk, or something that might be genetic to put them at risk for kidney disease. So I did gather some of these natural herbal supplements that you would want to avoid if you are to ever come across them. If you are someone that has kidney issues, or you have kidney disease, if you may be on dialysis, or you know someone, this is something that you might want to take note of and make someone aware. But I am going to talk a little bit about nutrition. And they also recommend that you need to carefully plan your meals. And this here, I think this goes mainly towards people that have kidney disease that has caused them to have to go on dialysis or have to get any type of dialysis therapy here. And some of the things that we just need to watch for and watch how much we take in. They recommend that you limit or avoid beverages and foods that have a lot of potassium, phosphorus, and sodium. Also, you want to make sure, if you're one that have kidney disease and you may be on dialysis, you want to make sure, or you may be at risk of getting on dialysis. They they watch your fluid intake. So some of the things about and you want to have a good dietitian also. You just don't want to just be putting any old diet together. You really want to team up with your doctor, your medical provider, and you want to really get a dietitian on board to help you with your diet and foods that are best for you, a diet plan that is going to be best for you if you're one that may have issues with your kidneys, or are you at risk for kidney failure, and you they're talking about possibly dialysis. So you just want to make sure you get sound information on the foods you need to eat, the foods you need to avoid. I would just, as a nurse that was working in the field, I've just seen a lot of people miss really inappropriately guided on what they can do or what they might could get away with. And sometimes just the wrong bite of something could really mess you up and cause you to go backwards when you might be making progress. So those are some of the things that I just recommend, even as a wellness coach and someone that has really pushed really forward towards the natural alternatives and the wellness side. I also tell people to use wisdom and really get the right advice from the right people. Go ahead and talk with your medical provider. Go ahead and get those other people on board, especially if you're someone that has health conditions and you may be at risk for things, or you have a family history of something. You want to have the right people in place to give you sound guidance on some of these things, as simple as a meal. Also, you want to keep a journal, a meal journal of your daily intake throughout the day, broken all the way down to exactly what you have eaten, and how much big of the portions, how much fluid, which fluids did you drink? Did you drink 4 ounces of cranberry juice? Did you drink 200 mLs of water? You really want to have that stuff down to a T, because when it comes to something maybe possibly worsening, or you just feel things are just not the same with your body, you want to have that information. And those are simple things that you could do that can really help your provider kind of get a general idea of what to look for and how to treat you as well. Get the testing done. Get those tests done if you're a person that is at risk, or you may have family history of some of these health conditions. Get those tests and the blood work. Go to get your physicals and all of that. Be aware. Make sure that you're looking up research studies, stuff that have been proven and factual. So the things that people with kidney disease should do: lower high blood pressure, manage blood sugar levels, reduce salt intake. And I think just about every show I've done it talked about reducing salt intake. I haven't had a show yet that talked about increasing salt. That's just need to be in our head, period, to watch the salt intake. Also, moderate protein consumption. Get an annual, it says it recommends you get an annual flu vaccine. Things everyone should do: exercise regularly. Also, try to make sure you control your weight. Follow a balanced diet. If you're a smoker, talk with your doctor about smoking cessation classes that can help you to quit smoking. Also, drink in moderation. Stay hydrated and monitor your cholesterol levels. Get an annual physical and make sure you know your family's medical history and what help, why this stuff here. I know that you can shift the dynamics of your health, because I'm one that was on a lot of those medications. Number one, I was on cholesterol pill. I was on a pill for kidney protection. I was on a pill to manage my diabetes. I was on heart medicine. And just shifting my eating habits, just losing the weight that I did, just shifting my lifestyle and certain things that I was doing, it changed a lot of the things that was going on in my body. No longer taking a bunch of hormones and steroids. It just really helped my body to kind of get back to a norm or a baseline that was conducive, that I wouldn't have to take those medications anymore. I'm one that I can talk about stuff from evidence of what I experienced. I used wisdom. I did make sure I talked with my doctor. Did I implement some natural alternatives? Yeah, but then I made sure that I learned what would be best for my body. If I had a certain health condition, what supplements would be conducive for me to take. So I just believe if we talk about it, we got to have some type of evidence going on that we have overcome and achieved the things that we are talking about here. So I talk as a nurse and a wellness coach from things that I was able to conquer health-wise, life-wise, health-wise, balance, all of that. So these things are near and dear to me. I never got diagnosed with kidney disease, but I was at risk because of me being a diabetic, and I was on medication for that. I said was. I was on medications for several things. I no longer take those medications anymore, and I've been feeling very great lately. And my body tells me when something just doesn't agree with your body. If you done had health conditions and stuff and you try to eat this stuff, you try to implement this stuff, you don't rest properly, you don't follow up and talk with your family members, your grandmas, your aunties, your uncles about certain health conditions that saw was a trend in your family. That stuff all plays a big role and is very important to be aware of. So I'm going a little further here. And I felt I needed to say that because I just wanted to let someone know that you can have a lot of stuff going on, but this stuff you can be able to safely, as your health get better, come off of these medications. But you got to do it safely, and we got to do our part. And this is where this come in, presenting this information, listening to shows like mine and other people that are actual healthcare advocates that go a little bit deeper in research and getting the studies and the notes and the statistics together to present to you. And also just my personal story, just telling you some of the things that I had experienced, even, reflux. I mean, I could show you the list of medications I was on, and I was able to safely come off of these medications. But I had to use wisdom. I had to implement what I was teaching my patients and what I was talking to them about, and what I was telling them. You can't have that those two pieces of cake, and I'm gonna end up having to give you coverage because your blood sugar gonna be over the numbers, and then you're gonna have to get coverage and your Lantus, things like that. So these are the things that I like. I like to present on a different level, but I like to let people know that we have to do our part, and we got to want to have awareness. We got to want to know about awareness, and want to learn about this. I know it's not one of those wilding out, presentations, because I just want people to have their headspace where they're just listening and say, oh, she mentioned this, or she mentioned that, or even go back and watch the replay tonight and just say, oh, she talked about this. So I'm going to go here. I'm going to talk about some natural herbs here. I'm going to talk about supplements that you need to avoid. So natural herbs, we have beets. And these natural herbs are some that were found to be safe to use. So I'm talking about the herbs that are found to be safe to use for what research studies have shown that they are safe to use. And I'm also going to cover some of the herbal supplements that you should avoid if you have kidney disease or you may be at risk for kidney disease here. So natural herbs, we have beets. What does beetroot do for the kidneys? Well, it enhances your production of nitric oxide. Nitric oxide dilates the blood vessels, which increase blood flow. This additional blood flow can help your kidneys work better than when blood flow is restricted. The bright red pigment of beetroot is called betaine. It can help reduce inflammation and oxidative stress. It also may help protect your kidneys from damage. So that was for beetroot. Now I'm going to talk a little bit about milk thistle. Milk thistle, what does it do for the kidneys here? Well, it helps kidney tissue recuperate faster when it's exposed to damaging chemicals. So those are the benefits of milk thistle for the kidneys. And it's also full of antioxidants, and it can help you produce more of your own antioxidants. Okay. And then milk thistle also helps to increase the expression of genes involved in generating 3 of your body's powerful antioxidants in the kidneys. So another one that I found that was pretty interesting here is parsley, the herb parsley, which I love parsley. I put it in a lot of my food here. And parsley is a fantastic herb to help prevent kidney stones because it has a diuretic action. When studied against other substances, parsley reduces stones the most. You heard I said study research done. The size and number of stones significantly went down, and the kidney tissue was healthier as well. Parsley is a potent natural kidney cleanse herb. So those are a couple of natural herbs that can be implemented safely, meaning that you consult with your medical provider and you make sure that it won't be contraindicated with anything else you may have going on. But those ones will focus towards helping and aid and assistance with the kidneys here. Now, I want to talk about some herbal supplements that you should avoid if you have kidney disease or you may be at risk for kidney disease. Some of them is horsetail, licorice root, barberry. Here it has nettle or stinging nettle. And then we have yohimbe, cat's claw, Java tea leaf, Oregon grape root, and Ruta graveolens. So these are some rare names, but these are some natural herbal supplements that if you're one that may be at risk for kidney disease or have kidney disease, you want to try to avoid these supplements here. All right, here. So here I was looking at some foods that you could safely eat here that could help cleanse the kidneys here. It says apple cider vinegar and preferably Mother Earth, the mother one. Also, they have kidney beans, they have lemon juice, watermelon. We have pomegranate, basil, we have dates, and we also have dandelion. Also, as far as exercise, exercise induces the changes in the renal hemodynamics here, and electrolyte and protein excretion. Effective renal plasma flow is reduced during exercise. The reduction is related to the intensity of exercise, and renal blood flow may fall to 25% of the resting value when strenuous work is performed. So here, when it comes to exercising, you just want to be careful of some of the exercise that you may take part of. You want to make sure that it's not going to be harmful, then helpful. You want to also consult with your doctor about that. What's a safe exercise for me during this health condition I may be experiencing? What should I implement? Should I focus more on doing stuff with the legs, the arms, different things like that? Just examples. Just make sure you mention that to your provider here. It was a lot more information, but I just want to give you a little tidbit of something just to bring awareness that this is Kidney Awareness Month for the month of March here. This is Kidney Awareness for the month of March. And I thank everyone for tuning in. I do want to let you know that this is the last month that I will be going live on Facebook through my business page for my shows. I will finish out the month of March. Then starting April, I will be airing my health and wellness shows on Roku and Amazon TV, which will be 4 shows a month, and you'll be able to watch them. That once they upload, they're up there forever on that channel. It's going to be on Big My Entertainment. Make sure you download that channel on your Roku and your Amazon TV. It's going to be airing on that channel there. And I'm just awfully grateful here. Also, you want to make sure you follow me on all of my social media platforms. I got several events coming up. If you want to get involved, be a sponsor, contribute to the my community efforts that I do through Jeanna's iFeed, and also through Just Jeanna Skincare LLC. Me and another business called Cultivated Miracles, we are coming with a awesome wellness, beauty, and knowledge surge 2021, May the 15th. We are gonna be teaming up, and we're gonna be presenting this wellness surge to the community. And guess what? If you're local, it's free. It's free. We have a dynamic panel. All are going to be talking about their health and wellness expertise. We have a vegan chef that will be on site. We also are going to have IV drip in the building. We're going to be having a young lady that is a nurse and well experienced that's going to be speaking and talking about that, and she's going to have that on site. It's going to be a dynamic event here. We're going to have one of the best CMOS creators in the area. We're going to have natural juices, samples and stuff. We're going to have just a great health and wellness educational experience. Also going to be relaxing, but you're going to have great takeaways, and it's available virtually as well. No matter where you are at in the United States here, you can be a part of this event, because guess what? It will be streamed live if you're not in the Hampton Roads area, and you will get the full experience, because guess what? We're going to be sending a event kit to you, so it will be as if you're right in the building. And that information is going to be loading this week on how you can make sure you are part of that experience. Also, if you would like to become a sponsor, information is going to be uploaded this week for that as well. But it's going to be May the 15th. Also, Gina's Eye Feed is coming to the Eastern Shore May the 22nd. You don't want to miss this. We are doing a massive food distribution, and I have teamed up with another nonprofit organization in that area, and her name is Miss Frances Bailey of Red Door Empowerment, and also we have the infamous Michelle Harrison of Solid Rock Ministries, who is bringing the whole truck. She is the food distribution guru in this Hampton Roads area, and that's on period. No one can put a mega event together for food distribution like she can. I've seen it and I experienced it. We are going to be prepared to feed 500 to 700 families that day. We will move out 500 to 700 families. Not only are we going to do food distribution, I have secured over 1,000 masks to present to each family. Also, the first set of cards are going to get gas cards. Yes, we're going to give you gas cards along with your food distribution. And it's going to be right in the heart of only Virginia on the Eastern Shore. If you live in Pocomo, if you live even in Princess Anne, you might want to drive down. You won't even have to get out your car. You just going to drive on around with your trunk up, and we're going to load you up at each station, and you got the rest of your day to have a blast and enjoy yourself. But Eastern Shore, we are coming, and we're coming strong on May the 22nd. Get ready, mark your calendars, clear out your trunks, because we're bringing some great stuff over there to you, my hometown. So I thank y'all for tuning in. I hope this information was helpful to everyone. Please, please, please go back and watch the replay. If you have any questions, please reach out to me. If it's something that probably just you wasn't sure of or might not have made sense, or just reach out to me. Also, if it's something you would like to see aired, even once I transition over to Roku and Amazon TV, if it's a topic that you would like me to discuss or do a segment on, please email me at justjeannaskincare@gmail.com. Get your requests in the rotation so I can go ahead and put the research together and get the notes and everything together, because I don't just get up here and talk. I make sure I do look this stuff up. I make sure that, it's actual factual things that I'm talking about. So let me know, and I'll be glad to put your request in the rotation. Thank you again for tuning in. Make sure you, again, follow me on all my social media platforms. I also try to put on there even stuff that other businesses and nonprofits are doing in the community. I try to share their information as much as possible, because one thing I learned, it takes all of us. It takes all of us collectively to make a great impact. So I thank you for tuning in. I will see you next week, same time, Monday at 9 o'clock. And also remember, encouraging words that you can soar, but you must put in the work. You must be ready to activate and take off. Don't be fearful. Move forward. This is the year of leaping into the unknown with faith. And I know from experience that I have just let God take the reign and take the wheel, and amazing things are happening. Is it a struggle sometimes? Is it, do it get hectic? Do you want to say, forget it? Yes, I do. I have those little moments, but I dare not stop now when I done came this far. So keep going, guys. Y'all are rock stars, and I see a lot of you, and y'all inspire me greatly. Thank you. One of my mentors, so two of my mentors are on here tonight, Dr. Dion Gibbs, and also the infamous Tawana Gosens. And I want to tell y'all something. If you live in the Hampton Roads area, and even if you don't, because they can reach worldwide, check out Lips Beauty Bar and Supply. And guess who products is in there? You right, Just Jeanna Skincare. I am in this awesome, amazing store. So please check her out. If it's something that you might need or something you see in her store and you don't live in this area, she can get it to you. They have online services where you can order coming. So please check her out. Check out these business owners. And when you're viewing my show for the next couple of Mondays left, and you see people on here, go check them out. If they're business owners, go and follow them. Go and follow and like and share. And if it's a service you can't use, share it. Someone else might be able to use those services. I know for myself, I'm not for everyone. My products might not be for everyone, but someone else might need my products and services. So guess what? If you can't use it, share it anyway, because you might share it to my target audience. So thank you again for tuning in. Also, Miss Kirsten D. Hall Jordan. She is one of the owners of Spiritual Creations. If you hear on Praise Radio, they are advertised all the time. Make sure if you need any printing, banners, flyers, tents, they can get you right. Spiritual Creations, look them up if you need them for services here, okay? So thank you again for tuning in. Again, it was Kidney Awareness Month for the month of March. Make sure you watch what you take in. Be aware of your family history. Remember the risk factors, which is if you have diabetes or if you have hypertension, if you have a genetic disorder, go and watch this replay, okay? Watch the replay and get that information so you can just, really grab it if you didn't tonight, because this is great information here. And go back and listen to some of the herbs that I said you should not implement if you have issues with your kidneys. Also, remember the natural herbs that are benefits to helping your kidneys, which is beets, which is milk thistle, parsley, and in everything, moderation, okay? All right, you guys, I love y'all. Y'all have a great evening, and reach out to me for health and wellness. Health and wellness, I know my lane, honey. Skincare, nurse education, health and wellness, I'm your girl. In the community for nonprofits, if you want to know how to push out 100 or 150 meals and still be able to clock in to work, I'm your girl, because I was doing it for 2 months straight. I was feeding 150 seniors every Tuesday, and I was still clocking in work on time. I can show you how to serve in beast mode and still be able to function and be balanced. That is my area of expertise. If you want to know how to do it, you reach out to me. I can assist you in that area. And you can be balanced in your home, in ministry, in business, and in work. So have a blessed night, and I will see you next week.